By adopting Volpara, it makes us radiologists be able to do a breast density assessment much quicker. It also allows us to make a decision as to what supplementary screening this patient will require. So that has been very good to use because it allows quicker flow in terms of our workflow. Often we'll have a patient that comes in that will have a dense breast pattern. We do an assessment of breast density with Volpara, which tells us that this is an extreme breast density, which usually is a good correlation with our subjective assessment. We then actually do an ultrasound on these patients with a density D. Often we find lesions that we haven't seen on the mammogram.
Our techs are really involved in educating the patient on breast density. We've had Volpara now for over a year, so some of those patients have already got a Volpara scorecard, so we can see what they are, we can inform the woman of what their density is, and then recommend screening. Volpara Enterprise, to me, I see it as a software tool that pretty much monitors everything that happens in this room. So it can tell us how long the room's used, how long each examination takes, and by applying those metrics to every single image that we take and using that PGMI grading system, we get a really good overall view of the quality of our images and our tech's performance.
We also find that with using Volpara, we have better quality assurance because of the techs now having ways in which they can assess the quality of the images and change things like positioning and technical aspects like compression and the radiation doses. In that regard, I think that it's reassuring for both us and for our patients that there's good quality images and their cancer hasn't been missed because of poor quality on a mammogram.
Volpara Enterprises improves patient care by just giving the best images we possibly can for our radiologists to interpret. Really high quality images are critical for mammography. Top quality image, better interpretation, better outcome for the patient.
During the time of installation, we were given adequate notice and it was not disruptive to our work lists in any way. Basically, we didn't have it the one day and the next day we saw it on our screen, so it was very easy to use.
We're really excited too that this is a Kiwi company that we're supporting and we're working with. They are a terrific company, they're doing wonderful things globally and they're just taking mammography to another level.